of recommender wants to directly send it to Jill or myself, they can directly send those letters also. So I just want to make sure, yeah, the deadline's today, and you will get a response back sometime after May 11th, sometime mid-May.
What time today?
It's supposed to be 5 p.m. So
that's for the last minute folks like me, that's helpful. Okay, and let me now introduce Jenny Romick, who will introduce our speaker.
Hi all, I think most of you know me. I'm Jenny Romick, longtime CSDE affiliate and professor in social work. And I hope all of you get as lucky in your scholarly career as I feel to have met Ninez. So I'm going to talk a little bit about why I asked CSDE to invite her. I've been working for a while on a project that includes some data disaggregation work and representation of small populations. And a little over a year ago, my team was, reviewing articles and writing a review or something like that. And I got an invitation to be on a panel at PAA around data and equity issues. And I realized that a fellow panelist was a name, I recognized the name from the work we had been going through on data disaggregation. And that name was Ninez Ponce. And so we had the session and it was just fabulous. It was a great conversation. It was the DEI committee at PAA that put that together. A lot of letters there, none of them harmful. And it was a great conversation. And I was like, oh, well, this is cool. We went out to lunch, we kept chatting. And then later I actually looked her up and she's a fabulous scholar. So I need my notes here to talk about all of her accomplishments. She comes to us from UCLA, where she's a professor and endowed chair in their School of Public Health. She's the director for the UCLA Center for Health Policy Research and PI of CHIS, the California Health Interview Survey, which is the largest state survey in the US. She's an elected member of the National Academy of Social Insurance, has served on a bunch of different National Academy level advisory panels, worked for, I think, a previous White House on data disaggregation for Asian American, Native Hawaiian, and Pacific Islanders on the commission that worked that. And in general, she's a scholar who spends her professional work advocating for better data, particularly for people from small and or marginalized populations, whether that's ethnic minorities, sexual minorities, gender minorities, immigrant groups in the US. And she does this because she sees a through line to representation and better health. And talking to her last night, she said, I said, what should I tell you? What should I say when I introduce you? And she said, well, you can mention that I started life as a community advocate. And that's a through line that goes through her work. And she said you never really left that. And in fact, she's California raised and still has deep connections there, which includes lots of people asking her to do things for her from the community. And so I was part of CSDE asking you to do something for us, which is to talk about your work. So anyhow, grateful to have met you and thank you for being with us today.
Thank you so much, Jenny. Yeah, I was just so thrilled when the CSDE folks via Jenny's whisperings invited me, and it just shows that good scholarship is, I wouldn't say it's hard to find, but finding kindred spirits on this, and what I sensed in our panel, which included Stephen Ruggles, who, if any of you have used EPUMs.
Yeah, that's right.
So we were all, rigorous, objective, trying to kind of differentiate advocacy versus scholarship, but it's hard, right? It's never completely separate, and like good scholarship does require advocacy, if anything, at least to help inform what are the most pressing questions to ask. So you're not just in your beautiful room, by the way. This is, in a wonderful university, but also then once you do generate new knowledge and insights, that it is scalable and it is done particularly in low resource settings, because that's what we want to do. Is we want to make sure that the gaps in opportunity and information asymmetric knowledge gets disrupted. So I'm going to you're my first contact on this talk, so please be charitable. I am actually not going to talk about the California Health Interview Survey, which has been, I have 2 girls, and Jess is my 3rd child. So they say, so my girls say. But I'm going to talk about the what next is, once you put forth some good science, good scholarship, then it's to have it replicated, have it be done in other settings, and kind of add more to kind of the learning gaps or the blind spots that we have. So I'm going to do something completely radical, which is to talk about a qualitative analysis. How many people are qualitative researchers in the room? Oh, now I'm more nervous. So I am not a qualitative researcher, but I have good friends and colleagues who are. So here we go. So this talk is actually, we just finished this on looking at the Federal Register notice comments that came. There were 2. There were ones that came out in 2023 to comment on the potential update of what's called the Statistical Policy Directive 15 on how to collect federal race and ethnicity. And then in 2025, the comments on what to do with intermediate categories. So that's basically the talk. But along the way, I'm going to contextualize it by talking about why data disaggregation is important, and in a particular focus on the Asian American community and how that leads to health equity. And the Federal Register notices are in some ways, even though it's biased because it's people who have the wherewithal to get it together and write a letter and upload it to the Federal Register, it is still a voice. It's a convenience sample, but it's still a voice of community and how we're using it to inform this notion of racial classification. And then we're basically done. My colleague AJ Scheitler, who is here, who's Washington, DC. Oh no, where are we? Washington State based, but you were in DC. She's here, so she's the kind of my safety blanket over there to help in case I say something that's not representative of the collective thinking of the team. And then community standards to policy domains. I talk a lot about this, how community engagement is absolutely important. If you want to measure, if we want to have high fidelity measures of what people are experiencing, and you're representing it, purportedly representing it in data. This is just a visual from the Centers for Disease Control and Prevention, where it's kind of simplifying where we fit in this world of health equity. Whether you're a programs person, you're actually going and doing interventions, health equity strategies, online, frontline delivery systems, not just in healthcare, but wider social systems. And there's also policy. It's looking at some of the structural determinants, looking at income inequality, looking at universal preschool, looking at minimum wage policy. So law and regulations that improve what we know is population health, which is health, not the individual, not in the hospital room or in the clinic, but outside of that. And my lane, as much as I like programs and love policy, is on the measurement. At least for today, it's about the measurement. I think some of you as scholars, PhD students, master's students, professors, that measurement is absolutely key on the truth that we hope to generate in our insights, right? So measurement is absolutely key. So this is what is a fundamental infrastructure for achieving health equity. And so why do we measure race and ethnicity? And I'm sure this is among scholars here in the room who work on race and poverty, social class, that this is sort of a no-brainer, but just again, to contextualize that the measurement of race and ethnicity began in this country as an era of institutionalized inequality, right? I mean, that's how the impetus of the measurement in the first census. And there were also laws, and there were several laws, but I put forth the key milestone laws that provide evidence of this institutionalized inequality. The 1790 Naturalization Act, which limited citizenship to free white persons, actually probably just free white males. 1830 Indian Removal Act, which forced relocation of Native American tribes. The 1882 Chinese Exclusion Act, which banned Chinese labor immigration. This act was the first act that actually restricted immigration by ethnicity in the United States. And then the Jim Crow laws, which spanned after emancipation about 100 years, until like the 50s. Brown versus Board of Education Act in the 50s, and then the Civil Rights Act, Voting Rights Act in the 60s. So this post-slavery systemic segregation in the South. And then the civil rights and then data shifted more towards population data. The 64 Civil Rights Act, landmark ban on racial and national origin discrimination. This led to the reforms on immigration policies in the United States, which led to diversifying the population in the United States. And then in 1977, the Office of Management and Budget, OMB, Statistical Policy Directive 15, OMB SPD 15, established its first national standard for federal racial data. And this is kind of, I think our whole team just sleeps on OMB SPD 15. Which version? 77, 97, 2024. So in 77, the standards were a race question and a Latino Hispanic ethnicity question. The race question categorized the population into four major categories: American Indian or Alaska Native, Asian or Pacific Islander, Black, and white. And the ethnicity category was Hispanic origin, not Hispanic origin. You could not choose more than one if you're multiracial at that point in 1977. In 1997, there were updates, so 20 years later, and it was American Indian. Now it expanded so that the Asian or Pacific Islander category was separated because Asians and Pacific Islanders were mushed together in 1977. And so the big change was the disaggregation of Asians from Native Hawaiian or other Pacific Islander, and still had the Hispanic Latino ethnicity overlay. That means you could be Hispanic or Latino. You could be Hispanic or Latino of any race. So you could be Latino Black, Latino Asian, Latino American Indian or Alaska Native, Latino white. And for the first time, you could select more than one race. So this is back in 1997. And then in 2024, race and or ethnicity now is a single question. So whereas before there was Latino or Hispanic overlay, and now because actually the objective function of the census was to minimize the other category. So what would happen is that Latinos who would say, you know, to check Latino or Hispanic, when they got to the, and typically Latino or Hispanic is the first question, when you got to the race question, there were a lot of folks that would put other, because they say, I already said I'm Latino or Hispanic. You know, I remember Rob Santos, who was a former director of the census, says he really identifies with being mestizo. Where is that? How can I put that there? So I think the objective function and the listening sessions and the content tests that they do in the census, as they think about, they go back to drawing board, think about how to improve race and ethnicity, that the objective function was to reduce this other category. And one of the ways through their content tests, through their listening sessions, was to put Latino as a major racial group. So not have the two questions, but now have a single composite question of race and or ethnicity. And the other major change was to include the Middle Eastern or North African category. It was supposed to be introduced a little earlier than when it was finally introduced in 2024. I think they were trying to introduce it for the 2020 census, but the hiccup there, or the unresolved debate, was should it be similar to a Latino or Hispanic overlay? Because in MENA, you could be white, black, and Asian, but or should it be a race or ethnicity? So that was part of it. But when the decision to put Latino as single race, they just decided that MENA then would become part of this combined race or ethnicity category. And as always, can select or continues that you can select more than one race and or ethnicity. I'm just curious now, because I'm a survey researcher, how many is this completely new to people? Great, I'm in the right room. I'm in the right room because then we can think through the details. So the detailed categories then so this is how the census 2030 will look, at least as of what we know today. This was the intent of the 2024 revision. Can you see that? It's kind of very bright in Seattle today. So by the way, I'm going to try to end early because I can see Matt Rainier today. So the rumor is I'm going to run to wherever you go, the square with Min, to see Matt Rainier. So what you notice here is that there are checkoff boxes. And checkoff boxes, if you're in survey research, are great because it's a stimuli. It prompts you to check it off. It's also great for processing because then you don't have to deal with write-ins. Write-ins could be all over the place. And it's again, it gets at, it's actually in some ways a progressive statistical data collection tool because the smaller groups also get 6 categories, as well as the larger groups get 6 categories. So it's a way of visibility for smaller groups because you get 6 categories, even though that group is smaller, say, than the largest group. How it was determined and what goes into the check-in, and there's an other specify, which is always good because you may not see yourself in the check boxes, but you can write it in. It's principally through population size. So it's the largest groups, but the American Indian or Alaska Native categories was done through an interagency technical work group that tried to signal both the geographic reach, not just in the US of tribes, but also because the definition of American Indians, Alaska Natives is actually any indigenous persons of the Americas. So it includes Canada, it includes Mesoamerica, includes any of the Americas, Latin America. So that's why Aztec and Mayan are in there. So again, it's some of this, the size part is not as contested, but the American Inter-Alaska Native, the signal is in some ways also contested because of, should we include non-US tribes? So this was 2024 detailed write-ins. And so I'm going to shift now to the role of data disaggregation in data equity. And this is in one of our papers with Tara Becker and Riti Shimkata on in the annual review of public health, where I think the key takeaway here, if you can't see everything, is that community engagement is the glue. So community engagement is what's running, on the side there, where you do need that feedback loop, and that data equity is design, collection, processing, reporting, how you share the data, how you present the data. So it's all of this processes. It's not just, does your questionnaire, are you adhering to the OAB SPD 15 questionnaires? Also, like then how you design it, how you asked, how you share the data. So to understand community needs is really important. The programs and policies to address them is once you understand, then at least then you'll have an idea of how to fix it, because if you can't measure it, you can't fix it. And then hopefully with the improvement in health outcomes, improvement in reducing health inequities, and then literally then getting to health equity. So this is kind of just a schematic from data disaggregation to data equity to health equity. And then particularly for the Asian American population, these are just 5 facts about data aggregation. So why do we not like data aggregation? Why do I not like data aggregation? There's the model minority mask. Many of you, of course, have heard in the Asian American context, this myth of the model minority, or the mask of the model minority, where by averaging, by averaging a group that has high and low income, then the average, and if most of the large groups are higher income and most of the small emerging groups are lower income, then the average then creates this false narrative of how well a group is doing. So this model minority mask because of aggregation. Often we aggregate data. For those of you who are, in that produce data or that analyze data, it's noisy. I mean, these statistical noise is just, why disaggregate when it's just going to mess up my tables and there's all these, it's non-significant and I have to suppress. It's not really worth, what kind of insights can we have on this? So for example, Native Hawaiian Pacific Islanders are labeled as statistically insignificant in so many publications. So this treats human beings as errors and to justify their exclusion. So this is one of the reasons why that small groups are not represented, and because of data, and so they're aggregated into another category. Or with NHPIs, with Asians, which they aren't supposed to do since 1997. And then privacy as a pretext. Oh, we can't collect granular data. We have to aggregate, because even if we did, then it's you face super high disclosure risk. So disclosure risk then becomes like, I'm really protecting the public. And so I'm protecting people of this, of being seen for nefarious reasons, which is absolutely important. But you can't start, that can't be the pretext of not collecting. So that just can't be the pretext. And being seen in data is probably greater benefit, greater for the survival of a community, the resiliency of a community, than this notion that I'm actually protecting you from disclosure risk. Because you can protect, and there's other strategies for doing that besides aggregating data. Clinical invisibility and health erasure. When data suppression hides the high risk factors, such as high diabetes rates in Filipinos. I have a paper a bit on this in Filipinos. And clinicians then may fail to screen patients. Like they just will, again, part of the model minority myth. They'll look at you. I have a friend, Happy Araneta, Maria Rosario Araneta. She goes by Happy. And she is always happy. No, she's actually unhappy when she goes to the clinic and they see her as a skinny Filipino woman and they don't actually ask her for diabetes risk, because there's this myth that, and same thing with me, like I actually have family history of diabetes, but my doctor never asks or never does the test, because you have these stereotypes. I mean, clinicians do heuristics, they do like shortcuts, and it's based on stereotypes. And so some of that is fabricated through the aggregation of data. And policy and resource gatekeeping, again, I always tell the policy folks when I go testify in Sacramento or DC is that you want to be efficient and you can't, so data disaggregation is one way of being efficient in targeting resources and not being wasteful. Like, why do an intervention on colorectal cancer screening for a group, because Asians may have high, colorectal cancer screening rates, but it actually belies some of the super high ones in some of the limited English proficient communities, or it actually may, you're wasting the money because you shouldn't have targeted this particular group over another group. So that's, I think, why, it's precision. We want precision in our measures, but of course there's a cost, but that's the trade-off that we have to face every day. And this is just an AA and HPI context. I'm not going to go over this as much, but I was looking at this last night, and this is like my career. I started soon after 1985, and when Secretary Heckler put out one of the first Department of Health and Human Services in the federal government called the Black and Minority Health Report. How many of you have heard of the Black and Minority Health Report? See some, yeah. I mean, it was like one of the first. It sort of was the precursor, like then talk about health disparities, because it was using this notion of excess mortality, like looking at the actual mortality of populations, and then modeling what it should be. So it's like this excess mortality. They found that Asians had the lowest excess mortality across the major racial groups. And so that's, again, fueled the model minority myth. And with that, it did lead to community organization, because soon after this report was released, then national advocacy organizations such as the Association of Asian Pacific Community Health Organizations, or APCHO, which is a network of community health organizations, started, and also the Asian American Health Forum, which is now called the Asian Pacific Islander American Health Forum, two national advocacy groups started. And one of my first jobs after I got my MPP was with the Asian American Health Forum, working on data disaggregation. That's why I was like looking at this like, oh my gosh, since 1985, no, since 1989, I've been working on data disaggregation. It's much better. Good news is much better. There are more people. There were times when I was the only one who had to explain exactly what this was. So many people now are, they're in this, they understand data disaggregation, they're advocates, they're scholars. And so much, it's just so much better now. But the threat continues, policies change, populations change. What were refugees in the 70s are different from the refugees in the 90s. So because of that, it's a continuing evolving challenge to make sure that you provide, or you as scholars, you as data producers, provide, as I say, like the most representative data of a population that you're trying to address, you're trying to represent. So another example of a harm of data of aggregating data is this. This was not just, again, see, I'm really saying I'm not just a one-trick pony. I actually can look at other data sets. So this data is from vital statistics. This is COVID. And I had to do a FOIA, Freedom of Information Act, to get this, because the death rates that were being presented to the public were aggregated death rates for NHPIs and Asians. And so after getting this, I mean, the key takeaway is the state total for COVID, this is 2020, COVID deaths per 100,000 was 84. And if you look at the aggregate Asian and NHPI, which is the second bar, it's 75. So again, policymakers would say, oh, they're lower than the state average. So we're not going to give, you know, we're not going to triage, if we triage, we're not going to prioritize resources to that group. But if you disaggregate NHPIs from Asian, you get 123 over 100,000, which is greater than 84. And so that then changes the policy and resource allocation. And then if you further disaggregate, this is what I had to do with the FOIA, you see that the Samoan population is 182, the greatest, you know, compared to smaller groups. So the smaller groups, which is Native Hawaiian and Fijian, the two bottom, there's an asterisk by them where the deaths were fewer than 11 deaths. There's reporting rules. Of course, they differ by, like LA County had a different threshold than the state, but it was important, and this is through the Native Hawaiian Pacific Islander Data Policy Lab that's at the Center for Health Policy Research, was that they wanted to be seen. Like typically we could have just suppressed that, not reported Native Hawaiian, not reported Fijian, but the community wanted to be seen. But the stewardship is, we're also doing training with community organizations on how to consume data and how to note and say, okay, I mean, I'm not going to go around and say Native Hawaiians have 40 over 100,000, you know, 40 per 100,000, but to say, well, it was not statistically reliable, and what does that mean? So that way it's not, you're really doing, again, this data equity piece where you're reporting, so there's visibility, but you're also making sure the community understands what it means when we say it's not statistically reliable. So getting close to, oh wow, is it almost one? Oh wait, I started at 12:30. Okay, so this is how I miss flights. So great, like data systems are now collecting disaggregated granular data, but there still is the reality of disclosure risk. There's still the reality of statistical reliability, right? So some kind of re-aggregation there has to be some guidelines for that. And for CHIS, it's okay, because we'll just say, just pull several years of data. Then you'll get, then you can get at statistical reliability. But some data sets aren't collected every year or with harmonized data so that you can pull. So what do? You have to go back to re-aggregating to what I'm going to call intermediate groups. So how do you do that? Like, is there any guidance? And so there has to be a sense of typologies. And so this sets us up to our project. How do you connect? How do you aggregate into meaningful categories? So I didn't do it here because I thought it would take time, but how many people have played the Connect game, like New York Times puzzler? Oh yeah, it's actually good, if you think you had a stroke. I mean, it's really great for the brain, right? And so you get, and I say this because my girlfriend did have a stroke. She played it every day, and she's like now 100%. Not an RCT, but you know. So Teresa, what can you tell what the Connect game is? I hope you're Teresa. Are you Teresa? Yeah. Oh, Tiffany. No, wait.
There's like 16 words and you want to start for that.
Yeah, so she said that there's like 16 elements that, and then you're supposed to sort them into 4 categories. And it's supposed to be something related, but you don't really know. But it's, so you sort them out. And so this in some ways is what we were trying to do, was how do you connect these different groups of Asian categories. Now that data systems are collecting granular data. So some of the categories, the connections might be shared geography. Like we would put Washington State, Oregon, California together, right, as West Coast. So shared geography connected by common spaces, places that we have experienced. It could be shared risk, connected by common vulnerabilities, such as shared systemic exclusion or violence. So the shared risk, it could be occupational. It could be the groups that work in frontline, like the nursing field or frontline health field. So it could be this shared risk. It could be a shared institution. So groups formed around the reliance of the same infrastructure. Groups that are reliant on the Medicaid program, for example. Could be shared story, connections via historical experience, migration patterns, cultural identities. I'm Filipino, so my examples are actually very much about Filipinos. Like it could be, should Filipinos be geographically part of Southeast Asia? Or are they Pacific Islander because they're in the Pacific, or because we share a colonial history with Spain, should we be Latino? So it's like, I think so, like there's like so many ways that then you could be, or should we be with with groups that came here through the labor market shortages of nursing in the United States, because the Filipinos were brought in to that migration, labor force need. So this like kind of like there's very many ways of connecting, and the census by default and as a starting point is mostly through shared geography. So it's shared geography of East Asia, which I'll go into in the next slide. So here's a shared geography on intermediate groups. So it's East Asian, Southeast Asian, South Asian, and actually Central Asian is under the Asian category now, and then other Asian. So it's this geography-based census, intermediate categories, that is at one point a guidance to how to reaggregate. However, I think that the showcase contention was among the Hmong population, where the Hmong population was originally put in the East Asian category, because it wasn't just about geography, it was also about race biology. It was also that because Hmongs, the Hmong people genetically have genetic roots in South China, but then in China is East Asian, Chinese, that they were put in the East Asian category. Well, there was a lot of community feedback on not being put in that category, and even Southeast Asian may not be entirely satisfactory, because the Hmong and the Mien and the Burmese experience is going to be very different from Filipinos and Indonesians, Malaysians, Singaporeans. But it's in terms of these buckets that geography was kind of a default census piece. Because of that contention, the census then at one point decided that maybe we're not going to give standards. Maybe like this is too hard. Anytime you create standards, not everyone's going to be happy, and there's going to be complaints. People, and so it's not. Maybe we shouldn't have standards. And so the problem with that is that then everybody can standardize on their own. Again, I'm a measurement person. I still do believe in harmony, harmonizing instruments, and that also a lot of not just populations are comparative, but systems are comparative, structural systems. And so you do want to compare. So, so what the census did was put out another federal notice, and of what should these, should we do these intermediate categories, and any suggestions of what they should be. So that's always the second Federal Register notice. But just another look at the different groups, but also that these groups, you have a preponderance, you have like major groups that dominate each of these subcategories. So now comes in our project. What should these classifications be? So this project was is funded by the Robert Wood Johnson Foundation, and we're actually a partner with NORC from Chicago, so that we're doing these classification typologies from the FRN, but NORC is going to use it as an input along with listening sessions, some secondary data. They will actually come up with these typologies. So we're just an input, but I think we've had some interesting input. And this is why this is the first time this is being presented to this group. So our project is, as I said, there's UCLA, Robert Wood Johnson, and then it goes to NORC. The goal is to develop community-informed, evidence-based recommendations for how researchers should cluster the diverse Asian American population into smaller subgroups in ways that are feasible for real-world implementation. So hopefully, once we come up with typologies, there will be another RFP to then test these typologies in EHRs, in surveys, in administrative data, in WashPop, so that we can see then, does this make sense? So what did we do? We analyzed, there were two FRNs, again, Federal Register notices. The first was the OMB Statistical Policy Directive. This was in 2023, and they asked, we want opinions on proposed revisions for the combined Latino, Hispanic, the addition of MENA, and also the detailed race categories, which I showed you in that form. So there were close to 20,000 comments, probably even more. The 19,916 are scrubbed. I mean, they threw away some, whatever they thought through ML was garbage, but there's still like over 20,000 comments. It's one of the most comments that a lot of Federal Register notices have gotten. It took them they kept saying, we'll be done in 3 months to look at us. Oh no, it'll be 6 months. So it took a long time. There was somebody from OMB who retired because of this, because there were just so many comments. And so then because of these comments, the SPD 15 2024 revision came out in March of 2024. So the comments do have some weight. It did reflect the comments. So it's not just like an input box that nobody reads. They do read, and it actually does shape the way recommendations are going to be done. So then this whole thing about reaggregation came about, where the Census Bureau is like, oh, no, we're getting so much flack on doing geography-based clustering. So why don't we just put it out in the world, put it out in FRN and see what people say. So these were solicited to be submitted by February 2025. So we also looked at those, and it calls for opinions on the decision to drop the regional categories with, of course, an implicit invitation to, like, if we're going to drop it, should we have any? And if we have some grouping, some connections, then what, how should we connect these groups? And so much fewer comments, 2,000 or a little bit over 2,000 comments that were submitted. So my friend should not have retired, because that was like only 2,000 comments. So with FRNs, how many people have actually submitted to a Federal Register notice here or know what it is? Jenny, of course. So they, every time there's like, what should the discount rate be for the economists in the room? What should the discount be for public projects? They'll do an FRN. So I mean, so you can, it's a kind of citizen podium or box, where you can submit your comments. And so the strength of it is its formal documentation record of perspectives from different people. Historically, one of the key ways to gather input by Office of Management and Budget and US Census, anyone can submit. It's broad geographic reach, there's no in-person participation, and it's some part of our democratic process, of transparency and government accountability for the public policy students in the room. So the limitations, though, is, of course, it skews towards well-resourced organizations, to draft these comments, because it takes time out of your day. The written format creates barriers for non-English speakers and those with lower regulatory literacy. And there's awareness of open comment periods is uneven. You don't really know exactly when. And then unless you follow the Federal Register and you get notices. And then small communities that may have the most at stake, maybe those least likely to participate because they're so busy just they only have like 2 staff to deal with a community of people across several social services, so they're not going to have time to do this. So there's going to be, of course, some bias, a selection bias on the FRNs. So here's our approach. So given that, and this was our 15-month project, and we're pretty much done, is so how did we do this? As I said in the beginning, I'm not a qualitative researcher. I have a subscription to NVivo, so does AJ, and that's it. I know I am a journal editor, though, for JAMA Health Forum, and I do look, and I always seem to get qualitative papers. So I think the other editors think I do qualitative research, but I pose, but I'm not. I would say I'm a qualitative researcher. But certainly what's important in how ensuring, like, what are your biases, ensuring that there are multiple coders, ensuring, so kind of like just basic scientific principles that, of course, are at play. So what we did was we used Python to scrape and download all the PDF attachments. If you're ever going to do this, there is a download version, but it only downloads, but you still have to get content, so you still have to scrape the PDFs. There's keyword filtering, we used R. And the problem is that we couldn't just say Asian, because then we ended up getting so many, like somebody may actually say not Asian, like the negative. I'm not going to talk about Asians, but then we would scrape those that had any mention of Asians. So we had to like deal with this false positive challenge manually. So we scraped, and we had to manual winnowing. And then the final sample was a lot of winnowing. It's from almost 20,000 to 621 OMB comments. And then for the census comments, it was a little easier. It was 69 out of a little bit over 2,000 comments. So after we did that data kind of scraping, scavenging, then we did a thematic synthesis. And again, we followed the standards for reporting qualitative research for our framework. We had hybrid coding and Vivo 15 for dual deductive and inductive coding approach. 6 coders, they worked in pairs to ensure reliability, resolving thematic ambiguities. They met every week, sometimes twice a week, because we only had a 15-month period. And they put this into 7 final themes. Did you have your hand raised? Okay, sorry. Yeah, 7 final themes. But we also had an advisory board for community governance. I know a lot of you who do work have some kind of CAB, which is important. But these include community organizations, but also academic experts like sociologists like Min Zhou, who has expertise in Asian diaspora, particularly of Chinese and Vietnamese immigrants. And the CEO of CRAT, with this, the Southeast Asian Resource Center, an advocacy center. So we try to get community-based organizations, advocacy, and academic experts to provide iterative validation at every research stage. Karthik Ramakrishnan from API Data was also part of this. Here are our results. So first of all, we actually just did this because every time we present our results, we get questions like, well, who commented? Like I go first into like, what were the themes? But I always get the question, who commented? You know, because again, this is it's a selection bias on those who have the wherewithal to comment. So I'm going to start with who commented. And for the OMB, we looked at commenting organizations by race and ethnicity. And there were organizations and there were individuals. Like you as an individual can submit a FRN comment. So on individuals, actually individuals, and then not all individuals reported what their race and ethnicity was. In fact, most of them did not. But of those that did, some of the comments were, I'm Persian. And I want to say this, or I'm Armenian. So we would get this, that's how we scraped that data. And MENA, SWANA, race ethnicity had the most. But for organizations, the Asian organization, actually the Native Hawaiian Pacific Islander organizations outperformed the Asian organizations. Very organized, although I must say, somebody who works in Native Hawaiian Pacific Islander Data Policy Lab, I think he wrote 20 letters. So again, like there's then this clustering too, right? Advocacy. Yes.
Yeah,
Oh, now it's
signaling
really.
to you that you want to wrap up.
Okay. So I'm gonna wrap up. So I'm gonna wrap up, and because it was like, how did it go from 1 o'clock to 1:26? So the main themes I want to say is the definition of who is contested. So as Asian. So that was one of the themes, and the categorization of Asian groups, and then suggestions for alternate terminology and for improved methodology. So the boundaries, of course, the main contested was the MENA SWANA communities, because SWANA is North African, Southwest Asian. So it was like there are some that were in the MENA, some Asian groups would be like South Asian groups would be in this SWANA group versus in the MENA group. So that was one of the contested categories. The Philippines was a surface of distinct access. I think I talked about, are we Pacific Islander? Are we Asian? And the Central Asian group also, a lot of contestation on whether they should belong in the Asian category. And so this is just like, I'm gonna try to, we mapped out the themes and of contestation. Red here actually is they're not contested, it's East Asian, but everything else, a lot of the purple and the purples and deep purple are the ones that are contested. So you see it's South Asia, so it's Pakistan, India, Afghanistan, one of the most contested categories. Do they belong in South Asia? Should be Central Asia, I think is the question. And then all of the stans, Kazakhstan, Kyrgyzstan, is also like, again, should they be part of Central Asian, or should they belong to, some of them comments where should be part of the Turkic people, and Turks, Armenians, Georgians, Azerbaijan are white in the census category. So you see, like, it started to have like then there's a lot of contested things. And then there were some other themes that we had, which I won't go through because we're about to be so over, so sorry. I'm gonna just get to the main discussion, is that that the key limitation is that, of course, the skewing, but it is a way, and the key takeaways, Asian as a category, commenters have raised questions on who belongs, how geography should define. Visibility of smaller communities, still a dominant concern, and the classification decisions are not neutral. Everybody was very adamant about this, this is just going to, short of saying destroy my life, but just misallocate resources, to my communities. And the work is ongoing. It's going to go to NORC. With the takeaway, this is my last slide, is that a single typology, a one size fits all, may not be appropriate across all domains in health, education, economic, opportunities, immigration. And health equity typology may need to foreground Southeast Asian refugee communities. The Southeast Asian refugee community really felt they didn't really quite belong in Southeast Asian with the other groups, but that should be the foreground when thinking about granularity, further granularity. Must be community engaged. And so now we've handed this over to NORC, and they're doing listening sessions, and to see what some of our findings on themes, then how then they will put it together to come up with typologies for this group. So was that good? Like finishing up like 10 slides in a few minutes. So thank you for your attention. I'm sorry I went a little bit over and I rushed the slides, but I hope we can have a good discussion. Yeah.
We usually try to wrap up at 1:30, but I don't want you to leave without some questions. So maybe you can just collect a few questions, and for folks who have to go, do you have one online? Oh, you have class, yes.
Oh, so sorry.
So I guess if folks have to head out, oh, and you're doing that. Yeah, do you want me to? All right, sorry for that detour, but if you've got to go, I guess now is your chance. If you can stay for a little bit, maybe you can collect some questions.
Yeah, yeah.
And then we'll let folks go, and if they can stay a bit.
Okay, thank you so much. I'm so sorry for going over.
I mean, I have a million questions, but I will.
Yeah. Hi.
And it came this week, just as the world we categorized Pakistan as from consolidation category to being category. And another regional categories we are remembering with all of your knowledge, if you know if these global conceptions of regional ethnic categories impact maybe on the census categorized spot or the US.
So the question was, so I could repeat the question about Pakistan being recategorized from the South Asian category to the MENA category. Was that from the census? Was that, who did it? Oh, the World Bank. Yeah, the World Bank has a different typology. I think, yeah, it's a different typology. So I'm not sure how that's going to translate into the way the census is going to do it. As far as I know, the threat is more, will the census execute the 2024 revisions? Not how they will do it. It's more like, will they do it? And for Pakistan, as you saw, it was one of the kind of purple areas. But if that's the case, where do they put Afghanistan? I think my question was, if they put Pakistan in MENA, then Afghanistan must be in MENA too, right? Because it's like they have Dari Farsi is very similar. You know, there's like linguistic connections that are closer in some ways. So I do think that's also by geopolitical income. So the World Bank categorizes low, middle income countries by their lending portfolio. So again, in that case, the purpose is their lending, like in the tranche of lending. I used to work for the World Bank, so their tranche of lending. So that may be, you know, why they're doing it that way. But in terms of US population characteristics, the connections, the geographical connections are, that's why Central Asia, in some ways they kind of skirted the idea by putting Central Asia also with Asian category. But that said, that's why we're going to have a lot of what we're going to be writing about is about the contested areas, because I mean, that's where people will need the most guidance, right? I think it's going to be okay, like for Chinese, Japanese, Koreans, East Asian. No, that's East Asian. But there's the contested categories is where there needs to be a lot of scholarship and guidance on. But thank you for raising that. But again, it fits to, like, it's a different purpose, right? World Bank's purpose is a different purpose.
All right, it's so fascinating to think about the different stakes between the
Yeah.
World Bank and the census and other folks. If you will all join me in thanking Dr. Ninez. I'm definitely going to stay behind and ask a couple questions. So if you guys want to stay behind, you're welcome to.
Thanks
And then
so
we have
much.
Pizza lunch afterwards.
All right, thank you.
Yeah.
Thanks so much. And thank you for the invitation to come here on this gorgeous day where I hope I will see Matt Rainier, but I will. So thank you so much for coming and for your attention. I'm at nponce@ucla.edu if you also need to get going or prefer written word versus spoken word.
Great. And maybe that's especially good for folks online.
Yeah.
Because I don't have access if you guys are sending questions online. So please
Oh,
send an email.
I don't think there's any on the chat. I don't see chat. So I don't see anything on chat.
That's good. I think we can stop or we can like get out.
Yeah. I'm so sorry.
No, it's okay. I was trying to give you